Think Lyme disease is the only tick-borne villain? Meet Anaplasmosis, its stealthy cousin that slips into your white blood cells, dodges your defenses, and can knock you flat if you're not paying attention. Anaplasmosis, also called human granulocytic anaplasmosis, is caused by a bacterium named Anaplasma phagocytophilum. It spreads through blacklegged ticks, the same ones that carry Lyme disease and babesiosis. Cases are most common in the Northeast and upper Midwest, especially in spring and summer. Inside the body, this bacterium hijacks neutrophils, prevents them from dying, and turns them into safe houses. The immune response itself drives many of the symptoms, and sometimes patients are co-infected with Lyme or babesia. After 1 to 2 weeks, patients usually develop fever, chills, severe headache, muscle aches, and crushing fatigue. About a third also experience nausea, abdominal pain, or diarrhea. A rash is rare, unlike in Lyme or ehrlichiosis. Severe cases, especially in older or immunocompromised patients, can progress to respiratory failure, shock, kidney injury, bleeding, or even multi-organ failure. Lab findings often include low white blood cells, low platelets, and elevated liver enzymes. A blood smear may show morulae inside neutrophils, but it's not very sensitive. PCR testing is the best diagnostic tool, while antibody tests confirm infection later. Treatment is straightforward and life-saving. Doxycycline is the first-line therapy for everyone. Adults take 100 milligrams twice daily for 10 to 14 days. Children of all ages receive weight-based dosing up to the same adult maximum. Pregnant patients with severe disease still receive doxycycline. For milder cases, rifampin may be considered. Most patients feel better within 1 to 2 days of treatment. If not, co-infection should be suspected. Untreated disease can spiral into respiratory failure, bleeding disorders, or multi-organ dysfunction. But with prompt doxycycline, the outlook is excellent, with mortality under 1%. Prevention is key. Wear protective clothing, use repellents like DEET or permethrin, check for ticks after outdoor activity, and remove them quickly. Key clinical takeaways. Anaplasmosis is a tick-borne infection caused by Anaplasma phagocytophilum. Symptoms include fever, headache, muscle aches, and gastrointestinal upset, with rash being rare. Labs show low white blood cells, low platelets, and elevated liver enzymes. PCR is the best diagnostic test, though blood smears may sometimes show morulae. Treatment is doxycycline for adults, children, and often pregnant patients. Rifampin is an option in pregnancy if the disease is mild. Most patients improve within 48 hours of therapy. And prevention relies on tick avoidance, repellents, protective clothing, and prompt removal. So here's the bottom line. Anaplasmosis may not be famous, but it's rising fast. Recognize it early, treat with doxycycline, and you win. Ignore it, and that little tick can cause big-time trouble. Knowledge really is the best bug spray.